I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It, Episode 3. Be sure to subscribe to this podcast, and you'll never miss an episode on how to naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
Hey folks, Dr. Joe here. Hope everybody's having a wonderful day. What we're going to talk about today is something that affects a lot of you, really sometimes on a daily basis. We're going to talk about alcohol and what alcohol does to your brain, because it's important that you understand what happens when you drink. Because a lot of people say, well, Dr. Joe, I just like to have a drink. It's no big deal. I have a glass of wine at night. It helps me unwind. It helps me sleep. I've heard it 1,000 times from every excuse you can come up with. I have kids. I work hard. I'm alone. I'm never alone. And alcohol seems to be the thing that we fall back on as our crutch. The problem is that you don't understand what it's doing to you. It makes you feel good. Well, whenever something changes how you feel, good or bad, there's something going on with the brain. The brain controls everything. Your brain sits up in your head and it sends messages down your spine, out your nerves to every cell in the body. So there's a nerve that goes from your brain to your heart, your lungs, your liver, your spleen, your kidneys, your toenails, everything has to be connected to the brain. And when you put alcohol into your system, it's affecting brain function. Now, you may think, well, that's a good thing. It helps me relax. And if I relax, I do better. Not really. That's kind of a myth. Yeah, you should relax, but there's a lot of other things you can do. You could do things like St. John's wort that helps you relax. You can do valerian that'll help you relax. You can drink water. You can exercise. You can change your diet. You can get chiropractic care. You can fix your digestive system. So what alcohol does, it treats the symptom. It doesn't treat the cause. And as a chiropractor, my job is to get to the cause of your problem and not just treat the symptoms, the exact opposite. Now, many of you know that studies suggest that alcohol in moderation can promote good health, even help ward off diabetes and dementia. You've heard those studies, right? Same thing with coffee. Let's talk about that. Fewer people know that there's never been a study ever to prove a causal relationship between moderate drinking and lower risk of death, only that the two go together. Now, that being said, and I'll probably cover this again later, is that if you moderately drink, you probably have a better lifestyle than somebody who drinks heavily, right? And so that could be the reason why you have less dementia. Now, you start to think, well, what's moderate drinking? Well, we'll talk about that in a little bit. It's not a single study ever done on moderate alcohol consumption and mortality outcomes that is the gold standard kind of study. When I say gold standard kind of study, it's a randomized control clinical trial where you're required to have in order to approve, let's say, a drug. You have to have this double-blind gold standard study, and no one's ever done that with alcohol. So we're just kind of putting out, if people do this, then they do this, there must be a causal relationship. Not always. Sometimes, but not always. Now, alcohol has been tied to breast cancer. It can lead to accidents. Now, as a chiropractor, of course, we see a lot of car accidents and sports injuries. And many, many times the car accidents are caused by people that are drunk. Well, you're thinking to yourself, well, why are you arguing with that, Dr. Joe? That's how you make your living. I understand that, but I'd rather make my living getting sick people well than dealing with accidents from something that's totally avoidable. So even alcohol in small amounts is linked to liver disease, cancer, we talked about, heart damage, strokes. More you consume, more damage there is. I always say a little bit of alcohol, a little bit of brain damage. A lot of alcohol, a lot of brain damage. 6 minutes after consuming alcohol, just the equivalent of about 3 beers, changes start to take place in your brain cells. The concentration of substances such as creatine, which protects your brain cells, also decreases as the concentration of alcohol increases. So your protective mechanisms start to drop the more alcohol you drink. Choline, this is a part of the cell membrane, is also reduced. Now, the cell membrane is a coating around every cell, and it's how nutrients get in and waste products get out. And if you start affecting how the mechanism or the cell wall works, we got some pretty serious issues. Because the cells, think about, we're just a bag of flesh. We're susceptible to temperature changes, we're susceptible to injury, we're susceptible to chemical reactions. And when you start intentionally messing in a negative way with the cell function, it's not something that's going to have good outcomes. Now, again, you've probably heard alcohol can be beneficial if you consume it in moderate quantities. About one to three standard glasses of alcohol a day is what's considered moderate consumption. There are thousands of studies on alcohol consumption and how it affects your health, and researchers still can't prove that moderate drinking leads to longer, healthier life. So don't buy the fact that somebody said. I always wonder where that somebody is, and then I always have to ask, too, who funded the study? If I was going to give you $1 million, and more than that probably, $10 million, and say, all right, I want you to say your favorite color is blue, and when you see blue, you get happy. What are you going to tell me your favorite color is? Okay. Got to always look at the source. Once again, like pain, you got to get to the source of the problem. What we have found, however, plenty of evidence showing that structural damage to your brain as well as detrimental effects, even when consumed in small quantities, happen when you drink booze. You don't get away unscathed. Some people say, well, it doesn't affect me. I have a very dear friend of mine, one of my best friends in the world, and boy, does he like to drink. And he'll say, yeah, wife and I had a couple bottles of wine last night. It's like a Wednesday. And I'm like, you did what? A couple of bottles of wine? That's crazy. After work, like to relax, like to unwind a little bit. Well, it's going to come. It has to get you. You cannot be immune to this. It has to cause damage. And also, you might say to yourself, well, my grandmother drank wine. My grandmother drank wine. She lived to 98 years old, had 10 kids, and she drank wine every day. But homemade wine, without the sulfites, without the chemicals, not added sulfites, chemicals. The grapes then were organic because we didn't have any other choice. Everything was organic before we started coming up with pesticides and herbicides and genetically modified foods. And she drank little amounts. I remember she had it was a jelly glass, if you're old enough to remember that. A jelly glass. Jelly used to come in glasses, and you'd pop the top off, use the jelly, and have this reusable glass. A lot of Flintstones glasses I remember at home. And it was a small amount, and many times she'd water it down with some seltzer or some water. So the wine, even a Bible, they're not drinking wine like you would think about pouring a glass of wine and drinking it. The wine was watered down. It was a way to preserve grape juice. It added a little flavor. So it wasn't like you pounding the wine and getting hammered. You have to drink a lot. There was some alcohol in it, of course, but it wasn't the same dosage that we're thinking about when we think about alcohol today. Now, it's far more telling than anything else. There's a lot of studies showing it causes brain damage. And it's hard to imagine any significant health benefit that could outweigh the destructive things that alcohol does to you. So don't give me this, well, it might do this, it might do that. What about the negative effects? And I always do that. Weigh the good and the pros and the cons, the good and the bad, and see what you come up with. New research, the possibility that moderate alcohol consumption might actually reduce your risk of dementia. Numerous studies clearly indicate alcohol consumption causes too many direct negative neurological complications to say that's even a real benefit. You want to reduce dementia? Change your diet. Increase your circulation to your brain. We know that dementia is linked to things like too much sugar and also linked to circulatory issues. So if you have a standard American diet, alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas, chances are you're going to start to develop a little hardening of the arteries. And next time you get your blood work done, I want you to get something tested. I want you to get something called C-reactive protein tested. C-reactive protein tells us how much inflammation there is in your body. And many times that inflammation is in the artery walls. Now, it's general inflammation, not specific for arteries. But then you can measure something called homocysteine. Homocysteine years ago was never tested. Even when you request it, I don't even know what that is. Now it's becoming more standard. And homocysteine will tell you how much cholesterol is being stuck to the artery walls. Because you can take an x-ray and see cholesterol built up on the artery walls. In fact, just last week, patient came in. She was a patient a long time ago. And she moved or whatever it was, came back in. And we took x-rays. And sure enough, we saw some pretty bad hardening of the arteries on her x-rays. And I told her, I said, this is a very serious condition. Oh, I work out, I eat right. And she was in great shape, a senior. In great shape, ate a very good diet. But when in her younger years, remember I talked about you always have to pay the debt? In her younger years, she drank diet soda all the time. She didn't eat good food. She always ate bad foods and alcohol and coffee. And so now she's paying for the sins of her past. But in her mind, she eats right. She exercises. I'm fine. So I brought it up to her several times, and she was being a stubborn patient. And I said, listen, I can't continue to tell you that this is a very serious condition and you need to get to a cardiologist right away. I'm not going to say it again, but I am going to make a note in my notes that I told you this numerous times and you refused to go. So finally she went, and sure enough, she came back in the other day and she was actually a little bit in tears. Excuse me. And she said, I want to thank you. And I said, thank me for what? She said, you pushed me real hard. And when I went to the cardiologist, he was shocked, that he didn't find it. Well, I don't know why he didn't find it. It's clear as day on an x-ray, so obviously it would show up on any test. And he explained to me how serious this is and what I need to do to get it fixed. And what his advice was, which I loved, you go to Dr. Joe, do what he says. He's the best. So it's kind of nice. I get that all the time. Excuse me. From doctors. I had a patient come in the other day from a car accident, and the attorney said, listen, you have to go to an orthopedist, you have to get an MRI, you got to get a CAT scan, get a neurological workup. He says, well, my doctor is Dr. Joe Esposito. He said, oh, he knows exactly what he's doing with car accidents. Just do whatever he says. So it's nice having a good reputation in a community. But it was tough for me to beat this into this woman's head that she had a real serious issue. And a lot of it had to do with alcohol consumption and coffee and bad diet and diet sodas and artificial sweeteners. So you will have to pay sooner or later, I promise you. Researchers discovered that creatine and choline, remember we talked about that? They decrease when you drink alcohol. Concentrations in your brain decrease. Creatine is involved in energy metabolism, protects your brain cells, and choline is a component of the cell membranes. And that probably indicates, according to this researcher, Armin Bieler, probably indicates alcohol triggers changes in the composition of cell membranes. The follow-ups on the next day showed that shifts in brain metabolites can be 100% reversed short term. When you start looking at long-term alcohol consumption, that's when you start having problems. Another study, Human Psychopharmacology, I'm sure you have that magazine at home, addresses the chronic effects of low to moderate alcohol consumption on the structural and functional properties of your brain. You've heard me talk many times in the past that a lot of your healthcare is structural, not chemical, or physical, not chemical. Structure affects function. Best kind of patients we have are nurses. Nurses understand healthcare very well, and doctors. Doctors and nurses make great patients because they understand when we explain to them pinched nerves affect nerve function, which affects organ function, and they get that. The second best group of patients we have are engineers. And the reason I say that is engineers understand one simple concept. Structure affects function. Whether it's a building or an engine or a car or your body, if something's not structurally sound, it's going to affect how it functions. And so when I show an engineer an x-ray, they'll go, okay, so that's normal and this is me, right? Yes. Okay. So I got to get me to normal. Yes. Okay, what do we got to do that? They don't argue. They don't question. They get it. You got to fix the structure in order to fix the function. And as chiropractors, that's what we do all day. Now we're seeing that alcohol affects the structure of the cells, which is going to affect the function. Study concluded even heavy social drinkers have no significant neurological or hepatic problems, show signs of regional brain damage and cognitive dysfunction. So even if you're a heavy drinker and you say, I'm fine, I'm okay, it doesn't bother me, I wake up, I don't get a hangover. Studies now show it is affecting the brain. Changes are more severe and other brain regions are damaged in patients who have additional B vitamin deficiencies. Now this is the irony of alcohol. Alcohol drains your body of B vitamins. You need B vitamin, in this case they're talking about B1, thiamine. You need B vitamins to make the nervous system work. So alcohol is now affecting the nervous system and it's depleting your body of B vitamins, which you need to make the brain work. So one of the supplements, what I do is when I create a supplement, I say, what is the biggest demand that I find among my patients? And so originally I came out with Dr. Joe's Super Greens and Dr. Joe's Essential Source. That's the minimum amount of nutrients you should be taking every day. They're 2 powders, they taste great, but dollar for dollar, you're not going to get a better deal, if you will, on anything as far as when it comes to healthcare. Because it's prebiotics, probiotics, digestive enzymes, a complete multivitamin, somewhere around 5 to 10 servings of raw fruits and vegetables in one serving. Alkalize the system, loaded with minerals, omega-3 fatty acids, iodine comes from dulse, which is a seaweed. So I put together what I would consider the minimum amount of nutrients you need. So if you're going to do nothing else in your life, at least please take Super Greens and Essential Source. I also came out with a Dr. Joe's B vitamin complex because a lot of us are depleted in B vitamins. I'm a vegan. I don't eat any animal products. Haven't for over 30 years. And you get B vitamins from rotting flesh, B12 specifically. Being that I don't eat rotting flesh because the bacteria eat the flesh and as they digest it and it starts to rot, it creates B vitamin, B12, I take a B supplement. Most people over 30 or 40 have adrenal problems. You're stressed out, you drink coffee, you're not sleeping right, you're not getting enough exercise, you're getting too much exercise. So I have an adrenal supplement. Almost everyone is deficient in vitamin D. So I have a vitamin D supplement with vitamin K2 in it to help build bone mass. And we have a probiotic. We have several other supplements. They're all on my website, drjoeesposito.com, or you just Google Dr. Joe. But folks, if you're doing nothing else, please make sure you're taking Dr. Joe's Super Greens and Dr. Joe's Essential Source. If I have time today, I'll try to get to it. I got a lot to cover. I'm going to talk about, if you do drink, what you need to do and what you need to take before and after drinking. So I'm going to try to get to that because I know you all want to hear that. But the supplements, my books, if you want to listen to podcasts of well over 1,000 hours of radio shows are podcasted on my website. We have videos on the website of live lectures that I've done. Come out to the live lectures. Sign up for my newsletter, by the way. Easiest thing you can do. Sign up for my newsletter. It's free. It's right on the homepage. And we'll send you information about supplements, if we have a sale on supplements, new supplements coming out, new research, when I'm doing lectures, when I do a live radio broadcast, when I podcast it. So just go and sign up for the newsletter, drjoeesposito.com, or just Google Dr. Joe. We come up first. Now, folks, if you want to make an appointment to come see us, we have offices in Marietta, Duluth, and Stockbridge, right outside the Atlanta area. We would love to have you as patients. We want to get your nervous system working again. We're chiropractors, neck pain, back pain, shoulder pain, numbness, tingling. We want to make sure we're checking all that to make sure there's no pinched nerves. If there are, we want to fix them. If you have acid reflux, heartburn, burping, gas, bloating, we want to fix that too. We can massage or adjust the stomach away from the diaphragm. And we want to make sure you're eating the right food. So if you want to make an appointment, go to my website right now, drjoeesposito.com. You can do it online. You can call us. We accept people with all insurances, no insurances. Sometimes, even not just me, but any doctor, if they're not in network with your insurance, many times you have better benefits if it's out of network. So don't freak out if you don't see a doctor on your preferred list. Many times it's better to not be on a preferred list. And that's why we're not in some networks. It's better for us and better for you to not be in network. So don't freak out about your insurance. Call us first. We'll talk about everything with you. Go to the website right now, drjoeesposito.com, or just Google Dr. Joe. We want to get you in as soon as possible. So more on alcohol here. Other hazards of alcohol. Alcohol is a neurotoxin. So the brain is the nervous system. Neuro means nerve, and it's a toxin. It can poison your brain. Even moderate amounts of alcohol I don't recommend because they can make you more vulnerable to various preventable cancers. Just drinking opens up your risk of getting a disease like cancer. It can harm your body's delicate hormone balance. We don't use a lot of hormones in our body. We have a lot of hormones, but volume-wise, we don't use a lot. We talked about B vitamins before. In a lifetime, how much B vitamin, B12, you think you can use in a lifetime? About a thimbleful. That's how much B vitamins you use in a lifetime. But it's sometimes hard to absorb. As we get older, our stomach stops producing as much acid as it used to, so it's harder to digest food. And the stomach produces something called intrinsic factor. And the intrinsic factor helps you absorb B12. So as you're getting older, you may not be absorbing the B12 properly. With me so far? So that's why it's important to take B supplements as one of the I take several supplements. But it can harm your hormone balance. Again, even though we don't use a lot, it's a very delicate balance we have. And of course, it can cause liver damage. Now, it goes without saying, if you're pregnant, please, I'm begging of you, don't ever drink any type of alcohol or fermented beverages under any circumstances, please. We don't want to damage the baby's very delicate nervous system. Much more delicate than yours. You know, what you do to yourself is your choice, but when a baby's involved, that's a whole different story. Alcohol consumption has been found to blunt responsiveness of the hypothalamus to the immune and other non-immune signals. Your hypothalamus is a part of your brain, and it's kind of like a way station. A lot of things go in and out of the hypothalamus, and it controls temperature, it controls the immune system, and so alcohol can affect how the hypothalamus affects the immune system. So if you have something like an autoimmune disease, a lot of people do, rheumatoid arthritis, Graves' disease for your thyroid, AIDS, can't think of the other one now. Anyway, a bunch of autoimmune conditions that are happening in the body, you got to be careful with. Because when you have them, the body's attacking itself. And when the body starts attacking itself, the immune system has to kick in to regulate. And if the hypothalamus isn't working, you've got problems. So don't mess. Remember, I say it a lot in my shows. Not nice to fool Mother Nature. You're messing with Mother Nature when you do these things. And once again, the alcohol they talked about in things like the Bible or even ancient Rome, much different than the alcohol we're drinking today. Much lower in alcohol content. Red wine. How many people have heard this? Red wine is good for you what? Your heart, right? Absolutely, must be true. Well, you've heard about it. Well, red wine is good for your heart. But it's not the wine that's good for your heart. It's the red that's good for your heart. The red part has proanthocyanidins, it has resveratrol, it has these other nutrients in it that are good for your body. And that's why we say eat the colors of the rainbow. The more colorful the food, usually the more beneficial it is. So red wine has resveratrol, and resveratrol can actually reverse, slightly, the aging process. But there's a problem. In order for wine to produce resveratrol, it has to be organic, what the grapes do. If you spray the grapes with an antifungal spray, because the grapes are exposed to fungus, they don't produce resveratrol. Resveratrol is produced to protect the grape against fungus. So if you're spraying an antifungal on it, the fungus isn't around, the grape doesn't have to produce resveratrol, and so the non-organic wine is just drinking booze. And you have to drink several bottles of wine in order to have a medicinal reaction. Now you're thinking to yourself, well, what I heard Dr. Joe just say is that I should drink several bottles of organic wine a day. No, that's not what I said. We're not married. Don't change my words around. What I said was you'd have to do that to get any benefit. Now you can get resveratrol from a lot of other things. Other berries, blueberries, peanuts, Japanese knotweed is something that has resveratrol in it. You can take it as a supplement. But here's the thing. If you live a healthy lifestyle, if you eat mostly fruits, vegetables, nuts, and seeds, if you take supplements, Dr. Joe's Super Greens, Dr. Joe's Essential Source is what I recommend, Dr. Joe's Adrenal Support, Dr. Joe's B Vitamins. Again, I put them together for you. It's real easy. You don't have to think anymore. I put it all out there for you. Chances are you're going to have a lot less damage to your genes. In the genes, you have a little tail. And this little tail is the thing that determines how old or young you are. And so this little flagella, it's a fancy word for tail, is very long and active when you're young. And as you get older, from free radical damage, bad diet, stress, we start to attack this little tail. And resveratrol can protect that tail from being attacked and keep you young, biologically young. But if you're not attacking it to begin with, it's not going to wear out as fast. And so you don't need to take excessive amounts of things like resveratrol. I put them in my supplements. But you don't need large amounts if you stop damaging yourself. Once again, we're getting to the cause of the problem, not just treating the symptoms. Does that make sense? Say yes. Good. I want to make sure you're getting all this. So if you're going to drink wine, it has to be organic. It's still loaded with sugar. And the sugar spikes your insulin, and too much insulin causes the cells to become insulin resistant. The cells don't want insulin to be... what happens is insulin goes to a cell, opens it up, and allows sugar to go in. If you eat too much sugar, you produce a lot of insulin. The cells can't take any more sugar. So the cells say to the insulin, stop trying to open me up and let sugar in. I'm not going to let you. And they become insulin resistant. That's also called type 2 diabetes, by the way. So if you're drinking a lot of red wine, you're still, even if it's organic, you're essentially drinking sugar. So if you want to get all the benefits, I put that in quotes, of red wine without all the downside, don't eat toxic foods. Stay away from what I call the 7 deadly sins: alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. Eat more fruits, vegetables, nuts, and seeds. Take supplements like Dr. Joe's Super Greens, Dr. Joe's Essential Source, the B vitamins, the adrenals. That's what I take every day. And people usually peg me about 15 years younger than I am. I like that, by the way. You can do it too. People come in all the time, say, I want to be like you. I want to have your energy. I want to have your thought process. I want to be able to think as quick as you do. And I say, stop poisoning yourself. Get your spine checked. If you have neck pain, back pain, shoulder pain, numbness, tingling, these are all symptoms telling you that something's wrong. All pain is a warning sign. Look at it as a warning sign, and you got to go fix the problem. And then, eat a good diet. Nobody's forcing you to eat bad foods. So it's not hard. It's easy. If you go to my website, drjoeesposito.com, if you sign up for my newsletter, which I think you should. We're going to send you a lot of information, not a lot, but whenever we have something new coming out, new research, radio shows, podcasts. But I'm also going to send you a lecture that I did, no charge, called So What Can I Eat? And in there, we're going to send you a link to it, and you can listen to it. It talks about the food you can eat. Not all bad. It's all good stuff. That's all good lecture. So that's kind of fun. If you want to make an appointment to come see us, we have offices in Marietta, Duluth, and Stockbridge around the Atlanta area. We would love to be your doctors. Go to my website, drjoeesposito.com, and make an appointment. We will set you up a time to come see us. We take people with all insurances, no insurances, car accidents. I've never seen a car damaged ever where the occupants weren't damaged. So if you're in a car accident, you need to come see us right away. Thanks for listening to For the Health of It. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 p.m. Eastern Standard Time on WSBRadio.com and on the WSB Radio app.